The end of free movement of workers from the EU has significantly increased possibilities of exploitation. That's what Care Watchdog tells MPs. The freedom of movement ended in the UK on December 31st in 2020 as a result of the UK's withdrawal from the European Union. This means that EU citizens could no longer move to the UK to live and work without a visa. The UK government's decision to end freedom of movement was one of the most controversial aspects of Brexit. And there were a number of reasons why the government made this decision. Because they said they wanted to regain control of the UK's borders. EU citizens were able to move to the UK without having to apply for a visa, which meant that the UK government had no control over who was coming into the country from the EU. And the government argued that ending freedom of movement would allow it to better control immigration and prevent illegal immigration. To reduce pressure on public services was another claim. EU citizens were a significant proportion of the UK's workforce, and the government argued that ending freedom of movement would reduce pressure on public services such as the NHS and schools. And they wanted to address concerns about social cohesion. Some people argued that there were too many EU citizens living in the UK and that this was leading to problems with social cohesion. The government argued that ending freedom of movement would allow the UK to create a more cohesive society. We now see how that worked. The impact of ending freedom of movement on labour shortages in the UK has been mixed after that. Some sectors of the economy, such as hospitality and agriculture, have experienced significant labour shortages as employers have struggled to find workers to fill vacant roles. However, other sectors of the economy, such as the technology sector, have not been as badly affected as they are able to attract workers from other parts of the world. The government has introduced a number of measures to try to address these labour shortages, such as the introduction of a new points-based immigration system. But all it did was to raise net immigration overall. But there are some key findings of a study by the Migration Observatory at the University of Oxford on the impact of ending freedom of movement on labour shortages in the UK. Labour shortages have been most severe in sectors that rely heavily on EU workers, such as hospitality, healthcare and social care. The end of freedom of movement has led to an increase in the average wage for some low-skilled occupations. Some employers have been forced to change their business practices to cope with labour shortages, such as investing in automation or reducing their opening hours. Overall, it is clear that ending freedom of movement has had a significant impact on the UK labour market. The government is still trying to find ways to address the resulting labour shortages, but the problem is likely to persist in the long term. And in a recent report, the Care Quality Commission, the independent watchdog for health and social care in England, has warned that post-Brexit restrictions on the free movement of workers from the EU have contributed to an increase in modern slavery in the care sector. The CQC has identified a number of factors that have made the care industry more vulnerable to exploitation. Of course, the shortage of workers. The UK's care sector has long struggled to recruit and retain staff, and this has been exacerbated by post-Brexit immigration changes. The CQC found that many care homes are struggling to fill vacancies, which has led to them employing workers who are more vulnerable to exploitation. And care work is often low-paid, physically demanding and emotionally draining. And this makes workers more reliant on their employers and less likely to report abuse. The care sector is also largely unregulated, which leaves workers vulnerable to exploitation. The CQC found that many care homes are failing to carry out proper checks on their staff and are not adequately monitoring their working conditions. As a result of these factors, the CQC has found that cases of modern slavery in the care sector have been increasing in recent years. In 2021-22, the CQC made 4 referrals about modern slavery in the care sector, which rose to 37 referrals in 22-23. And this year, the CQC is on track to make 50 referrals. The CQC has called for a number of measures to be taken to tackle modern slavery in the care sector. For example, the CQC has argued that the government should make it easier for care workers to come to the UK, which will help to ease the recruitment crisis and make it more difficult for employers to exploit workers. And the CQC has called for stronger regulations to be introduced to protect care workers from exploitation. This could include mandatory checks on employment agencies and improved monitoring of working conditions. And the CQC has urged care workers to come forward and report any instances of exploitation. It has also called for greater protection for whistleblowers, as they are often targeted by employers. The CQC's report is a stark warning about the impact of Brexit on the care sector. It is clear that the restrictions on the free movement of workers have made the sector more vulnerable to exploitation, and this is having a devastating impact on the lives of care workers. The government must take urgent action to address this issue and protect the vulnerable workers who are at risk of abuse. As you know, Brexit is the shorthand term for the United Kingdom's withdrawal from the European Union. On June 23rd in 2016, the UK held a referendum on whether to leave the EU, and the result was 51.9% in favour of leaving and 48.1% against. And the UK officially left the EU on January 31st in 2020 at 11 p.m. GMT. Freedom of movement is one of the 4 fundamental freedoms of the European Union. It allows EU citizens to live, work and study in any other EU country without having to apply for a visa or work permit. And this freedom has been a cornerstone of the EU since its inception, and it has been instrumental in the creation of a single market and the promotion of economic integration. The end of freedom of movement was one of the most significant consequences of Brexit. On December 31st in 2020, the UK ceased to be an EU member state, and UK citizens lost their automatic right to live and work in the EU. And this has had a significant impact on both the UK and the EU economies. In the UK, the end of freedom of movement has led to the aforementioned labour shortages in some sectors, such as hospitality, agriculture and healthcare. And a decrease in the number of EU students studying in the UK is another. But there was also an increase in the number of UK citizens living abroad, as they have taken advantage of the opportunity to work and live in the EU without restrictions at the time. In the EU, the end of freedom of movement has led to an increase in the number of EU citizens returning to their home countries. And there was greater competition for jobs among EU citizens at the time. And there was a decrease in the number of EU nationals working in the UK, which has put pressure on wages and working conditions in some sectors. The impact of the end of freedom of movement on both the UK and the EU are still being felt, and it is likely to continue to be felt for many years to come. And if you want to know more, the next video is right here on the end screen. I'll see you there. I'll be back.